At the funeral of her late husband, Justice Irene Mulyagonja recounted a journey filled with pain, desperation, and powerlessness. As one of Uganda's most respected judicial figures, she was expected to have access to the best services the country could offer. Yet when her husband fell ill, she couldn't raise the money quickly enough to manage his care. Turning down the idea of public fundraising, she tried everything else. First seeking help at International Hospital Kampala, then even traveling outside Uganda and finally to Mulago National Referral Hospital.
I had to find a way of looking after it. So we kept on going lower.
Even in Mulago Hospital's superior private wing, she witnessed severe medical neglect, a shocking absence of essential medication, and agonizingly delayed treatment.
End of his life, Mr. Kafukoza failed to eat. But you can come to a day where they tell you, oh, we are going to put an NG tube. Someone comes in the morning and says, oh, we'll put an NG tube. He disappears. The next person comes on duty and says, oh, we are going to put an NG tube, and he disappears. Then finally in the evening someone comes and says, you know what? We don't have.
Mulyagonja lamented that even in this privileged section, a basic shot of insulin could be unavailable. Her story is not unique. It is a sobering reflection of how even the most privileged Ugandans find themselves defeated by a healthcare system that demands more money than most families can ever afford. For the vast majority who are not judges of public figures, the experience is often even worse and sometimes fatal. Dr. Umar Yarugaba of Caremax Hospital sees this reality every day.
In Uganda, you are just one disease away from poverty. Be it cancer or diabetes or heart disease, all it takes is just one serious condition that can ruin your entire financial capacity for a lifetime.
Dr. Yarugaba gives an example of sickle cell disease, which affects over 20,000 newborns in Uganda each year. Tragically, 80% of these children never live to see their 5th birthday, not because the disease is untreatable, but because of the cost of treatment.
On average, a family with a sickle cell child spends over 2 million shillings every year in purchase of these drugs like hydroxyurea and some minor blood transfusions for these sicklers. But in times of a crisis, this amount can go way higher.
While public hospitals offer sickle cell care for free, frequent drug stockouts often push families to buy expensive medication from private pharmacies. He also references Casgavy, a new one-time injection that could potentially cure sickle cell disease. But its cost of 5 billion Ugandan shillings places it far beyond reach for 99% of families. Health burdens aren't limited to rare conditions. Everyday illnesses like malaria too can be financially crippling. In a country where most people pay for healthcare out of pocket, the high cost of survival has become a silent epidemic. And while many Ugandans have long cried out for reform, the solutions though proposed have been slow to arrive. In 2021, Parliament passed the National Health Insurance Scheme, meant to usher in a new era of universal health coverage. The promise was simple: every Ugandan, regardless of income, would have access to quality healthcare without having to fear bankruptcy. But years later, the scheme is still stuck in limbo awaiting implementation. In the meantime, Ugandans continue to suffer. Out-of-pocket expenditure still accounts for over 40% of total health spending. In government facilities, shortages are common and services overstretched, and private care remains an expensive option for all but a few. Dr. Isaac Kagolo of Inclusive Health Center in Nansana sees these pressures firsthand and blames much of the problem on systematic failure. Corruption in Uganda from the central to local government is costing health service provision, making it expensive and less effective, Dr. Isaac said. He also pointed out the lack of drugs in government facilities, the mishandling of cases and delayed salaries for medical professionals. All these factors, he argued, combine to make healthcare both unreliable and unaffordable. But while the cracks in the system are glaring, the government has recently stepped up efforts to address them and restore public confidence. Just last week, the Ministry of Health commissioned 28 newly refurbished and fully equipped health facilities across the Busoga region. The upgrade, supported through the Ministry of Health, WHO, and KOICA partnership, is intended to improve access to reproductive, maternal, newborn, child, and adolescent health services in the region. These facilities are expected to ease congestion at referral hospitals and bring essential services closer to rural communities. The ministry is also working to detect diseases early and link patients to timely care. In schools across Chira municipality, screening campaigns are underway focusing on tuberculosis, HIV, malaria, and even emerging threats like mpox. To strengthen healthcare delivery at the grassroots level, the ministry recently commissioned 152 community health extension workers in Butaleja district and Chotera. These frontline health workers are expected to bring critical services such as antenatal care, immunizations, basic diagnosis, and health education directly to the people, reducing the need for expensive travel and relieving pressure on hospitals. These efforts offer a glimpse of what a functional universal health coverage system could look like in Uganda. Care that is accessible, proactive, and community-based. According to Dr. Byarugaba, preventive strategies like screenings and informed reproductive health decisions could drastically reduce the cost of long-term care, especially for diseases like sickle cell. Dr. Kagolo, on the other hand, insists that for the system to truly improve, the government must go beyond policy announcements. They must punish corrupt officials, build more government health centers, equip them well, pay the medical workers on time, and treat them professionally. The truth is, Uganda doesn't need to create new miracles. It needs to implement what it has already pledged. The vision for universal health coverage has been painted clearly. Now the country must act on it fully, urgently, and without excuses. Until then, health may remain a costly challenge for many Ugandans, but with recent efforts gaining momentum, from refurbished health centers to school screenings and the deployment of community health workers, there is a growing sense that the tide might be turning. As Dr. Berhanga put it, health should never be a luxury, it is supposed to be a right for everyone. The road to universal health coverage is long, but Uganda is taking steps, and with continued commitment, stronger policies and support from all corners of society, a future where quality healthcare is truly accessible to all may not be so far away after all. My name is Shafiq Butanda, and this is Science Television Network.